Autumn, great to see you. Welcome.
Thank you.
It is Autumn is the first student I've ever known to go to Preuss. Autumn was actually a student in Vacation Bible School in my class when she was, how old were you?
I was like 9 or 10, like very young.
So 9 or 10, 11 years old, somewhere in there. She was
Maybe,
my
yeah.
So I've known her for decades on decades, known her family. She has a great family known throughout San Diego for service to San Diego and many different areas. And so me and Autumn go way back, and she's the only student that is fully comfortable calling me TJ. Everyone else is like, I know it feels weird to call you Mr. Carr. I know I graduated high school 10 years ago, but Autumn's like, I've always known you as TJ. So you're that one. Autumn, this is Oscar.
Okay, nice to meet you, Adam.
Nice to meet you.
Oscar was a teacher in our social studies department a few different times, but now he is in Maryland, still teaching social studies. Because we have Zoom, we can teach with whoever we want right now. So we are right now teaching with Autumn and Oscar. Autumn, where are you?
I'm in New York City.
New York City. So
Yeah.
we are multiple cities as we teach this class. So Autumn, or should I call you Ottoman? Back in the day. You were actually the first graduating class from Preuss.
Correct.
And might have been the first, literally the first person to walk across the stage, since your maiden last name starts with an A. So Preuss's first graduate. Once you left Preuss, where'd you go?
Yeah, so that was a journey. And so once I left Preuss, I attended Spelman College, which is a historically Black all-women's institution, and a private college, liberal arts college in Atlanta, Georgia. While I was at Spelman, I majored in economics and I minored in public health. Prior to attending Spelman, I never even knew public health existed. I was never even introduced to the field of public health prior to attending Spelman. But through a few classes, my anthropology class and health economics class, where my professor in that health economics class was actually a health economist teaching part-time at Spelman, introduced me to public health and looking at like disparities through, or like inequalities through the lens of like health outcomes.
So you've been fighting for social justice without needing a prompting. You've been fighting for social justice throughout what your interest is and your area of study and your career path. So where's your career path going? Well, actually, let me go back. Spelman, all girls?
Yes.
Private?
Yes.
Historically Black. How different was
Yes.
that than your experience in high school?
It was a lot different. I mean, from my experience in high school, from my experience growing up in San Diego, from my experience going to Preuss, which is kind of like a, you know, we were really sheltered there. And you're around students of your same socioeconomic background, or not, of your same ethnic, racial background. It was just different. And it's interesting because I'm a Black person. So, you know, you wouldn't think there would be like a culture shock going from San Diego, being a Black person in San Diego, to going to Spelman, a historically Black all-women's institution, but it was. First of all, one of the biggest culture shocks for me was Atlanta. Atlanta was a culture shock for me. And I went to Atlanta like in the height of the like crunk movement. I don't know, maybe dating myself, you know, you probably don't even know what that is, which is okay. But, you know, which is a very interesting cultural movement for Atlanta in general. And I went to school then. On top of that, Atlanta, not Georgia, but Atlanta in itself is majority African American, or Black, however you want to describe that social group. And so everybody was Black. Every single person, not my professors, but like every person, like at the gas station, in the grocery stores for the most part, at the restaurants, it was just a different kind of experience and a different kind of perspective, because the majority group in that city are people of color, and it's the South. And so it was just a lot of just adjustments, and it was beautiful, but it was also very overwhelming. And then in itself, being at Spelman, just to see representation of like not even African Americans, but of the African diaspora. I mean, I was going to school with people from like Cape Verde, which is like an island off the coast of West Africa, from Barbados, from people who were their family has been college educated and founders of companies since like the late 1800s. You know, just as the spectrum of the diaspora and what it means to be a person of African ancestry in this country was represented there. And it was very empowering, but it was also very overwhelming. And I've encountered like super rich girls, and I've never even encountered like super rich white people in San Diego, like super rich girls where they just came from like just not under, you know, even though we're both Black, we just had a different perspective because we had a different upbringing. So it was very interesting, but it was very empowering. The classes to be actually taught, you know, by very passionate, not only just Black educators, but just educators. One of my favorite professors, he's a French Huguenot, abolition, like has a history of abolition, being a abolitionist in his family. And he taught a nonviolent social change class, which was very pivotal to how I saw myself as a research practitioner and a research scientist. And this was just this liberal arts college through the lens of educating women of color, specifically women of African descent, with these just very diverse faculties. So it was super beautiful to be there. But it was also very overwhelming at first.
So that all played a role in you went to grad school after Spelman.
Yes.
You have a master's in public health?
Correct. I have 2 masters.
Okay. And what's the other one in?
Master's of Science in Epidemiology. So my first master's was at Boston University School of Public Health. I had more of an interest in global health prior to my practicum. In my practicum, when I went and did a research project in Uganda, and then came back and was like, I don't know if that's the right pathway for me. Even though it was a very interesting experience. Even that's a unique experience in itself, being in Africa, being of African descent, but not being of that ethnic group, and how I was perceived there was very interesting. It was a very interesting experience. We can talk later about that if you guys are interested in it.
Yeah.
And after that, I worked some time, and then I got a master's of science in epidemiology from Columbia University and Mailman School of Public Health. And that's where I'm getting my doctorate in epidemiology now.
All right. Oscar.
I'd like to, since we just got past that point, can you talk a little bit more about how being in Uganda changed or just influenced how you view yourself as an African American person? Like, what's that like for you going back to Africa?
Sure. That was, yeah. And mind you, I was like 21, I was 22. So I was super, super young, maybe 22 going on 23, being there. It was a lot. It was a lot. Even for me, I'm still unpacking that experience now, later down the road in life, with a little bit more emotional and emotional maturity and life experience. It was interesting because I thought I should have known when I was traveling to Uganda from New York, when I stopped in Abu Dhabi, you know, because I don't think the flight can go straight through. And then I stopped in Abu Dhabi and I was by myself, and I met another American. So we're sitting there, we're just together. We're 2 Americans on this flight going to Uganda to serve, pretty much, because it was, you know, practically you're pretty much doing work for free, exchange for the experience. And then some Ethiopian guys saw me and thought I was Ethiopian, so they embraced me, right? They were like, "Oh, hi, who are you? What's your name? Where are you from?" And so we're talking and having this conversation, and I didn't really know how important ethnic identity is when you go over to not a country but a continent, right? I'm within a country in a continent that I have really no reference for the culture or how they perceive me as an American with black skin, of African descent. So that was very interesting. So that should have been indicative of my experience, but I still didn't get it. So when I went over there, they were very confused by me because I'm with a group of, again, we're going over volunteering. So there's a disparity of who can even go over to developing countries and volunteer, right? So I'm with a group of white people volunteering in Uganda, and I'm the only black person outside of one other girl who is of East Asian descent. And we're some both like black, brown skinned people. And so how they perceived us was just so unique. First of all, because I didn't ethnically look like Uganda, where I was at, I was outside of Kampala, like 4 hours out, which is their capital, and a smaller village called Butongole. And it's a really rural village. And in that area, they're primarily of Bantu ethnic origin. And I ethnically do not look like a Bantu person, obviously. And so I didn't know that. That was obvious to them. That was not something that was obvious to me. And so I was embraced for the most part, but a lot of times they were really confused by me. I think because I fit in, I was in East Africa. So you have the Horn of Africa where you have like Djibouti and Eritrea and Ethiopia and all those places. So I fit more with that phenotype, right? So there was some type of misunderstanding. Like sometimes when people went to different countries and lived there of a different ethnic group, it was like, it could have some stigma associated with it. So sometimes when I was in a big group with all these white people, unfortunately, I was sometimes mistaken for a prostitute. I was not, you know, and so I had to be very careful about like wearing sunglasses and anything that like looked like I had money, because they would just assume that like these white people who I was with was, you know, some type of not, you know, a unique relationship was going on.
Yeah.
But for the most part, I got embraced, and I got embraced because I told them I was not there to dictate to them what the people needed. I was very interested in understanding the needs of the village that we were supposed to serve. And that in public health is called community-based participatory research. I didn't have that formal training then, but I understood like having that relationship helped me develop trust in the community. And I also made a point to try to learn the language. They speak Wasoga there. And I had a Ugandan name, it was Mutasi, which means princess. And so because I like had a little notebook where I was like taking down words so I can greet them and show them that I was very engaged in their culture, they over time learned to trust me and embrace me. But it was really challenging being over there because it is a cultural custom. So while I was there, a man had beat his wife to death, and he was not arrested because within that rural village, that was like not handled through like law enforcement, like the formal like law enforcement. And he attended the funeral, and it was very interesting. And it also gave me perspective of like, okay, I see this in a way because of how I'm socialized, but I can't come in here and dictate to these people how their customs are and how they're living their life. So it gave me a different perspective, and it also made me become introspective as far as like my own personal biases I have, and when I'm trying to help and what that means to try to help. You know, when people are not necessarily asking for your help and you're going there thinking that you're serving and you're doing well and you're doing good, but you know, there's a lack of cultural competence even for me, even though I'm a person of an oppressed group in the United States, that translates differently into what they need and their experiences there. So it was a very unique experience. It was a very eye-opening experience. It really made me lose faith in nonprofit and non-governmental organizations in developing countries, but nonetheless, it was a very good experience.
And So now you're getting your doctorate. And what are you hoping to do once you have that?
Yes, that's a great question, TJ. Before I discuss what I'm hoping to do, I can tell you a little bit of my logic of why I decided to pursue a doctorate. Because some people are just like, you just love going to school. You just want to just go to school forever.
Your degree, degrees.
Right. And that's not my objective at all. One of the reasons why I decided to pursue a doctorate is because in the literature, I'm very interested in health disparities research. I was very interested in cardiovascular outcomes and chronic disease outcomes in general, just because of health disparities. You know, people of color in the United States are disproportionately affected by every type of disease that you pretty much named, specifically chronic disease, which not only leads to poor quality of life, but increased risk for mortality. My dad died in his early 40s, and his death could have been prevented. My dad's situation is unique because there was some medical negligence involved, but just before that, he dealt with chronic pain, which is a chronic disease, and managing that and seeing that was, I really didn't even understand the impact that it had on me until later down in my life. And so, you know, I was very, very interested in not just doing the work, but being instrumental in what is being done and having research that is represented by, you know, oppressed groups, our research represented by a marginalized group, wanted my voice to be personally represented in the research. And then the more I learned about like wanting my voice to be represented, going back to Uganda, I also wanted our community's voices to be represented. You know, I don't even think it is our role as researchers to dictate to communities and people who we seek to serve, because it's a service, and inform what they should and should not do without their input. And so that just inspired me to go back to school and to want to put myself in a position to not just conduct research to serve, but conduct research, contextualize, representing voices of people who I intend to serve. And so that is the main reason why I decided to go back to school, and one of the main reasons why I'm torturing myself in this doctoral program, because it's not easy. And, you know, and I'm the only African-American in my cohort of 10. And none of my professors are of, there's one professor in my whole department, one who's of African descent. And yeah, that's just.
I have a question to follow up. There's a lot of talk about, like you just touched on, diversity in every area, industry, academia. And I think some people think that if people can study enough and become experts in every field that there is, and can you talk a little bit about, you're very educated. What aspects of your lived experiences that you did not develop through education do you bring to this research, and do you bring to this institution?
Very, very great question. I'm gonna have to kind of think about that a little bit. What aspect through my non-educated, so my lived experience, am I bringing to me, to the field, and as a research scientist, and even into my institution? So my story, my experience, I shared a little bit about, my experience with my dad, who prematurely passed away. But on top of that, just my experience and how I'm treated and how I'm perceived in general, walking through my day-to-day living as a woman of color, as a Black woman in the U.S. Even though, I do acknowledge that I have my own biases, because even in and I'll say this, and I'll be very honest about this, even in my struggle, I still realize I have a very privileged life, right? I went to Preuss. TJ talks about my family, how close my family was, and I had that social support and that family support and that structure to even have the mindset, even though my parents weren't formally, both of them had some college experience and college experience, but not formally have like a degree, but they have to know how to put their child in a better position to do better for themselves. And, you know, I have a brother who's special needs. I was born with the aptitude and the cognitive ability to pursue this in this manner. Not saying that he can't, but I'm just very aware of, like, even, you know, sometimes people think that, you know, they don't understand the nuances of a culture. And I understand that because I'm a person of color, and I see it even going to Spelman, and not even being educated there, but just being exposed to that diversity of the African diaspora and women who came from all different types of walks of life. I never really was exposed to women who, you know, were advocates for LGBTQTIA. I hope I said those acronyms right. But, you know, I wasn't exposed to that prior to going there. It was just a liberal arts, you know, very progressive school that exposed me to a lot. And it helped me have more compassion and understanding, and also more interest in wanting people's voices to be represented in the research that I do. But also helped me acknowledge that, like, just because I'm a Black person doesn't mean I'm the expert on Black people. You cannot study that. You cannot know that. It's impossible, you know, and to think that is just flawed logic. And me and people in my department have a fundamental difference in philosophies, because I don't subscribe to that. You can give me my PhD tomorrow, and I don't think I will be an expert on anything outside of what the literature tells me, and that's very biased, you know, or what I'm interested in. And I'm not yet for that, you know, I'm very aware of my limitations, even once I obtain this degree.
And it does sound like your experience with your dad definitely will color how you are, and that lived experience, because it sounds like if healthcare was different for him, that the situation may have been a different situation.
Yes.
And these are things that you're studying, and you're kind of you're able to share with your colleagues. You're able to bring this to the Mailman School, hopefully I pronounced that correctly, at Columbia.
Yeah, and that's a great point, PJ. It's what do you call it? It's providing me with another lens to look through based on my experience. And it just, you know, again, you can read all in the textbooks, but it's different when it affects you personally. It's a different type of motivation and passion and interest. And just knowing that disparate treatments are out there. When you look at maternal mortality among Black women in the United States, comparable to developing countries who do not have the same, you know, resources and healthcare, you know, and this is just like, and I think about my own experience as a Black woman and how I'm treated, and how, you know, my dad, before he passed away, he was in chronic pain. And before I was educated in school, I didn't understand that. Guess what? We're, as people of color, less likely to have proper pain management, because due to, like, slavery and just ignorance, they think that we feel pain differently. Like, it's that deep.
Right. And so do you feel like having more Black and brown people, especially Black women, talking about Black women's mortality rate, having more Black women in public health research, you feel like that would improve the research and the practices going down the line?
Yes and no, unfortunately.
How so? Yeah.
Yeah, I do feel like having more representation from Black, from brown, from diverse perspectives will help shape the research. But when we're there, that's not who our professors are. You know, that's not what the institution is interested in doing, you know, even when there's, you know, policy in place like affirmative action. So I think that it's it addresses the issue partly, but as a whole, from an institution level, there has to just be a radical change and perspective, and willing to have some discomfort, you know, for people of color to have a seat at the table and to have representation, and not just have representation, but to be valued the same.